Toppenish community is raising concerns about the local hospital shutting down labor and delivery services.
That due to financial and staffing concerns. KVU's Emily Goodell tells us for them, it's about safety.
For some expectant mothers in Toppenish, not having access to labor and delivery services at their local hospital isn't just an inconvenience.
It's not ideal, and these situations where you may have heavy bleeding or an ectopic pregnancy that a burst or something like that, there isn't time, and they need to have emergency surgery, and so an ambulance ride is just not going to cut it.
The hospital says they can still do deliveries in the ER, but if the mother needs emergency surgery...
So we won't have gynecology on call, so there won't be an immediate response to an emergent gynecologic surgery, but we will get people to the care they need.
The mayor of Toppenish says in her case, the minutes mattered.
My question is now, if a woman showed up at the hospital today with the ruptured ectopic pregnancy and internal bleeding, would they be able to have her in the OR in less than 20 minutes operating her? And if the answer is no, then that is not okay.
The hospital says it's not okay with them either, but they don't have the money.
I mean, it was devastating for us to have to close that program, and we want everyone to know we did everything we possibly could.
Their Sunnyside Hospital qualifies for special government funding for rural hospitals, but Toppenish falls through the cracks. Plus, they lost their 150% Medicaid reimbursement rate last year. Then, they lost the OBGYNs and pediatricians they were sharing with a community health partner. In total, they've lost $3.2 million over the last year just trying to keep it open. The hospital says it comes down to the money, and to get it, they need lawmakers to change the rules for helping fund rural hospitals so Toppenish qualifies or get that 150% Medicaid reimbursement rate back.
We need their support to keep our vital services open for the community.
In Toppenish, Emily Goodell, KVU Local News.
The hospital is working on lobbying lawmakers to make some of those changes, but in the meantime, others are hard at work as well. Yakima Valley Farm Workers Clinic says they're looking into ways to help provide transportation for those patients they have that might not be able to make it easily to another hospital. And community members are exploring the idea of creating a public hospital district where taxes from the community help fund local hospitals. But the hospital says it might be difficult.
Part of our service area is the Yakima Nation, and it's a sovereign nation. You can't tax the sovereign nation. And then that would just leave a small part of the community tax, and that's a very poor community, which just seems counterintuitive to the problem that we're trying to solve.
The hospital says it's supportive of any solution people can help with and encourages people to call their local lawmakers and ask what they can do to help with funding for rural hospitals.